as a trauma center, we have a very significant mission of doing outreach education. So this program kind of fit right into that mission and our values for what we need to do as a trauma center.
A lot of times emotions are high and they're ready to retaliate. So it's a good time to catch all of their friends in one location and stop them from going out and doing something stupid. We partner with both trauma centers, Creighton and UNMC, and we have a bunch of government partners also.
So our intervention with Impact One, Janette mentioned the interrupters, we call them. Our formal name for them is Street Outreach Specialists, and many of them were previous gang members.
Mainly what we do a lot of direct street mediation. When there's shootings that occur, if it's not a homicide, typically if the person's going to survive, the friends will show up at the ER and then they'll quickly leave. And they're leaving to go find the person who did it.
So Impact One really helped us in managing expectations. That's much easier for them, having those relationships in the community with these families, to get accomplished than it would be for me.
Out of that, we created Impact One, and our staff is very unique. Most of our staff is they're former gang members, or they've had some type of trouble with the law, but that actually gives them more credit in the streets, and it helps them. They're paying back to community, and a lot of times they know the parents of the victims that we serve when we go to the ER. Our program is loosely modeled after Ceasefire.
And she said, you know, I just want you to be aware that this gentleman's going to be in your waiting room, and frankly, if we can get into a room as fast as you can, that would be better for him and his safety, because he was perhaps thinking about not being in the gang anymore. So he was with the Impact One staff. We even had family request one day when life support was being removed from one of our gunshot victims that Impact One staff be there, because they'd already provided that level of support to them. And so what's helpful to us in the ER is they know these families. They were them. They know what our waiting room looks like when they walk into it. I don't know whether or not I have this gang here and this gang here. So it's very, very helpful from kind of an awareness perspective and a knowledge perspective.
We work with the families in the ER. We try to calm them down, and we work with the pastoral care to assist the family. And then after they leave the hospital, we follow up to help with funeral arrangements and just any other things that they may need from us.
But their main focus is not on the victim. That's our focus, caring for the victim. Their focus is on the family and the friends of that at-risk. We do a lot of education too out in the schools, doing trauma nurses talk tough. We do a lot of preventative education and safety education at health fairs and lots of different things as a trauma center as well.
We provide summer jobs. Now I think we're up to about 650 jobs that we provided.
I think our partnership works well because we're a committed group of individuals. We have great communication with one another.